Blood pressure should be assessed each office visit for all children over 3 years of age and under 3 years of age for children with special conditions. This video demonstrates the appropriate technique for measuring blood pressure in children. The first step is to select an appropriate size blood pressure cuff. The bladder of the blood pressure cuff determines the appropriate size. The bladder is the inflatable portion of the blood pressure cuff. The width of the bladder should encompass at least 40% of the child's arm between the acromion and the olecranon. The length of the bladder should encompass between 80% and 100% of the arm circumference. A blood pressure cuff that is too small can result in an overestimation of the blood pressure.
Okay, go ahead and uncross your legs for me.
Next, position the child so she is sitting with her legs uncrossed. Ideally, the child has been resting with her feet flat against the floor and her back supported for 5 minutes. The arm should be bare to the shoulder, with the upper arm at the heart level. If the upper arm is below the level of the heart, the readings will be too high. Similarly, if the arm is above the heart level, the readings will be too low. If the arm is held up by the patient, the isometric exercise will raise the blood pressure. The patient should be instructed to relax as much as possible and to not talk during the measurement procedure. When positioning the blood pressure cuff, the observer should first palpate the brachial artery in the antecubital fossa and place the midline of the bladder of the cuff so that it is 2 to 3 centimeters above the antecubital fossa. Placement of the blood pressure cuff 2 to 3 centimeters above the antecubital fossa will allow room for placement of the stethoscope. The mid portion of the bladder of the cuff should be in line with the brachial artery. Place the cuff on the child's right arm about 2 centimeters above the crease at the elbow. Only the right arm blood pressure and not the leg can be used to determine whether a child's blood pressure is normal or abnormal. The cuff should fit snugly, but allow 2 finger widths under the cuff. Auscultation is the ideal method for assessment of blood pressure in children. Phase 1, systolic, and Phase 5, diastolic, carot cough sounds are best heard using the bell of the stethoscope over the palpated brachial artery in the antecubital fossa. Lightly place the stethoscope about 2 centimeters below the edge of the cuff on the inside of the elbow over the brachial artery. Keep the stethoscope head from touching the cuff or the child's clothing. The key to good measurement is the use of a high-quality stethoscope with short tubing, because inexpensive models may lack good tonal transmission properties required for accurate auscultation. Apply appropriate pressure to ensure good sound transmission. Determine the level of maximum inflation by palpating the radial artery, inflating the blood pressure cuff, and carefully noting the point at which you no longer feel the radial pulse. To this number, add 20 millimeters of mercury. Next, deflate the cuff. Wait 15 to 30 seconds before reinflation. Inflate the cuff to the level of maximum inflation. Next, release the air such that pressure falls at a rate of 2 to 3 millimeters of mercury per second. The point at which the tapping sounds first appear for at least 2 consecutive beats corresponds to carot cough's sound phase 1 and provides the systolic blood pressure. The point where repetitive sound finally disappears corresponds to carot cough's sound phase 5. In some children, carot cough's sounds can be heard to 0 millimeters of mercury. Under these circumstances, the blood pressure measurement should be repeated with less pressure on the head of the stethoscope. Only if the very low phase 5 sounds persist should muffling of the heart sounds denoting carot cough's phase 4 sounds be recorded as the diastolic blood pressure. Both the systolic and diastolic blood pressure measurements should be taken at the nearest 2 millimeters of mercury. In order to properly interpret the blood pressure, a child's age and height percentile is needed. Any abnormal blood pressure, that is, blood pressure greater than the 90th percentile for age, gender, and height percentile, should be repeated during the visit. Document the blood pressure in the child's chart, including systolic blood pressure, diastolic blood pressure, location used to take the measurement, for example, the right arm, patient state at the time the measurement was taken, for example, resting or crying, size of the blood pressure cuff used, and the method of measurement. All children should undergo routine blood pressure assessment beginning at 3 years. Proper knowledge and technique ensures accurate measurement.